था, फिर अफसाने मुझे कहा था कि तुम इससे बात
history and where the stress management and stress issues was arise. So first, what are the understanding features of the stress? Most of the people, they think stress is also negative thoughts or negative perception of your memories. So this is not true in every aspect. Stress can be negative as well as positive. So usually for understanding of the negative aspect of the stress is the concept of the internal environment of the body, and in French it was called milieu interior, which was first advanced by the French physiologist Claude Bernet, and he described it as external changes uh, in the environment or external forces that change the internal balance, and it must be reacted to and compensate. So for it, the organism is to survive. So if somebody has having external changes, then he or she may have to respond to external stimuli in order to survive and in order to compensate these issues. So what is stress? Although most of the time and most of the people, they think it often isn't clear what stress is really about. They usually keep on talking like stress, 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 and even they don't have an idea what are the stress and stresses. And many people consider stress to be something that happens to them as a negative event, like an injury, loss of job, any misery in home, any death. And other thing, stress is what happened to their body, like changes the behavior in response to an event, like palpitations, anxiety, nail biting, or some movement of the neck. So it is defined by Selyle in 1956, and it is defined as the pressure experienced by a person in response to life demands. And these stress could be positive as well as negative. Say for if somebody is having exams nearby, then he or she may have to prepare themselves, and if they don't have these stressors, they don't prepare for their exams. And on the contrary, if somebody is having stress severe enough, then he or she cannot concentrate on the studies. So these stressors may be negative in their event. So this is the reaction of a person, how to deal or cope with these stressors. So it was defined by a pressure experienced by a person in response to life demands, and these are referred to as stressors and include a range of life events like any physical factors like cold, hunger, any bleeding from somewhere like hemorrhages, pain, and environmental condition and personal thoughts. And according to Selyle, this is a process of adjusting to or dealing with their circumstances in order to physical or psychological functioning. Say for stress is tension, that could be strain or pressure from situation, and it requires to use, adopt, or developing new coping skills. And these stresses are essential for our life to grow our careers as well as to excel in our jobs as well. So these are the few factors like time management, any death, any health issues, time, and bills payments nowadays, as because of the corona pandemics, most of the people have lost their jobs. So anxiety of their jobs, late night sleep, and all these factors. So first, what are the stress and stresses? In order to understand the stress, first, what is stressor? Stress is a stimulus that usually causes some changes in your behavior, which is called stress. Like I already told an example, if ISRA University suppose announces that tomorrow is going to be an exam, so this is a stressor, and your response will be stress. So this is response to events that are threatening or any challenging. So it is said by Selyle, it is not stress that usually kills us. It is our reaction to it, whether we go with stress or whether we cannot survive with these stressors. So these are the sources of stress. If you look at it, like social circumstances, career instability, any spiritual thoughts, health related issues, financial budget problems, any intellectual activities, or some personal issues in families. And these can be good stressors, which is called eustress, like getting into colleges, admission in university, getting engaged or married, winning the lottery, having a baby. So these are the good stressors, like having a baby. Now you have to adapt yourself for the sleeping patterns and all these issues. So these are the good stressors. Now, what are the bad stressors? Like difficulty with work environment, like your boss is not good enough, university campus related issues, threats of personal injuries, or any disease in the family, or death in your family. So these are the bad habits or bad stressors with this distresses. So how we divide stress categorizations. So these could be acute or chronic stresses. Acute is usually for a short period of time, that could be because of in the hours or days, and maybe due to work pressure, any meeting deadline pressure, any accident, overexertion, physical activities, or searching something but you misplace it. So symptom of this type of acute stresses are usually most of the time with abdominal cramps, diarrhea, constipation, that is stomach problem, with a headache, back pain, palpitations, muscle aches or bony pains. And chronic stress is usually prolonged. That leads to months or even years. And this is because of financial like poverty, broken or stressed families and marriages, chronic illnesses of themselves or their families, or successful failure in career or exams, or over enthusiasm but cannot achieve these goals or targets, or over expectations, like someone is having uh, social income issues, like he or she is getting 1 lakh annually, or he is having expectation that I can earn more than a million in next year, but he or she couldn't achieve these goals, then these leads to chronic stresses. And such side of stresses usually they usually present with chronic fatigue syndrome or with the fibromyalgias, and these stress can lead to generalized anxiety disorders, depression, mood disorders, or even schizophrenia as well. So lots of mental health issues, and these are very dangerous if somebody is having chronic stress and they are not consulting any doctor or not dealing with these issues. So categorization of stresses. Previously we were dealing about acute and chronic stress. Now what are the types of stresses? Usually these are three types of stresses. First is cataclysmic events, which are the strong stressors that suddenly and typically affect many people in life, like natural disasters, rain, storms, that usually hurricanes, that usually leads to disasters. Versus stressors like major life events, the death of family members, or immediate negative consequences. Background stresses, these are the common stresses we usually facing nowadays, like traffic noises, minor irritations, and long-term events like compound with other stress events. So these are the everyday annoyances, like being stuck in traffic, office issues, university or colleges issues. These are the long-term effects, and one of the common stresses is usually background stressors. And a theory developed by states that what happens if somebody is having stress or stresses in their life. Then it is suggested that a person's response to stressor consists of three stages. First stage is that is alarm and mobilization. Third stage is resistance, and if somebody is having severe enough, then go for exhaustion or mentally fatigue. So alarm and mobilization usually this is flight or fight response, which causes somebody to be ready for physical activity. Like I already told, if ISRA University announces exam over the week, then every student will strive for their preparations to get good scores and passes their exams. So this is the fight or flight response to to combat these stresses. Next stress is resistance. If stress continues and body adapts to these stressors it is being exposed to. And being medical professionals, we are usually in a stage of resistance where we used to face monthly tests, exams, annual exams, then activities. So we are usually in a phase of resistance where we adapt to these stresses. Initially, if you remember when you were in your first year MBBS class or in the pre-medical classes, then you people become very much annoyed by these stresses. What the hell? I mean, daily exams and all these stuff. But now your body is immune and resistant to these stresses, and now you're at top of it, how to deal with these exams and these monthly classes. So stage 2 is resistance, and if somebody is unable to deal with resistance, then go for exhaustion, and this leads to severe mental fatigue and number of uh, physical as well as metabolic and hormonal changes, which lead to health related issues. So if stress continues to exist for a longer period of years, then one present with a phase of exhaustion. So these are usually general adaptations of the diagrammatic picture. First is stressor, then meeting and resistance stressor, which I already told, an exam, then you are having books, then coping with stress and resistance to stressor, and negative consequence, which ultimately leads to mental fatigue and exhaustion. Now, what are the indicators of what are the manifestations somebody is having stress? So these could be physiological consequences, psychological, as well as cognitive or intellectual effects. So physiological indicators are usually having palpitations, pupils dilate to increase visual perceptions, increase sweats, heart rate increases, that is palpitations, skin is usually pale due to peripheral blood vessel constrictions, and maybe dry or urine output decreases. So these are the physiological responses if somebody is having stress or anxiety. Then palpitation or pounding heart, dry tongue, dry mouth, decreased urinary output. The skin becomes pale due to peripheral sympathetic activity, which leads to peripheral vessel constrictions, as well as sweat production is increases, and patient becomes too much panic or a lack of sleep. So the manifestation of stress include anxiety, fear, anger, and feeling of depression, and unconscious as ego defense mechanism. And now, what are anxiety? Usually, it is a state of mental uneasiness or apprehension, and it can be experienced conscious, subconscious, or unconscious. It doesn't matter. Somebody when comes to our clinic, and we ask, "Do you have any anxiety or stress?" They usually says, "No, not really." But when we dig out their problems, then there usually we found something that these patients may have some anxiety in their subconscious mind, and they are usually, most of the time, patients are usually unaware of anxiety states or any depressive states, because they usually having a resistance phase and used to deal with the daily anxious states. But in subconscious mind, these are the features of anxiety. Fear is usually emotion or feeling of apprehension, and patient feels or seeming danger and pain or any threat. And depression is extreme feeling of sadness, despair, and lack of worth or emptiness. And this is a phase where patient have manifestations of lack of sleep and continuous thought process, low mood, and suicidal thoughts, and all these stuff. So unconscious ego defense mechanism is usually psychological adaptive mechanism, and it leads to personality changes and define itself and intense tensions. Now, cognitive indicators are usually problem solving or intellectual activities. Due to severe stress and mental exhaustion, patients are unable to deal with these intellectual activities. And the person usually assesses the situation or problem analyzes and choose alternatives, carried out selective alternatives, and evaluates. And usually, patients assume a manner and facial expression that conveys a sense of being in control or in charge. But usually they don't. They keep on thinking their underlying etiologies and underlying stressors, and unable to fulfill their cognitive functions properly. And that's why their social as well as their job work sacrifices a lot due to these anxiety states. And most of the time, because these people are having lack of sleep in their usual habits, So daydreaming and daytime sleepiness is very common in these patients. Now, how to manage if somebody is having stress? So there are many factors which can cover up the stress issues. These are non-pharmacological as well as pharmacological methods. So coping with stress, efforts to control, reduce, or learn to tolerate the threats that lead to stress are known as coping. And when habitually use certain coping response to deal with stresses. So if somebody is having ability to control, reduce, or at least tolerate these threats, then this is called coping. So there are different steps. First, in order to deal with the stress, first you have to identify which are the stresses and why you are stressed. Any social issues, job related issues, work issues, health related issues, or with the study issues. So first you need to identify, you need to calm yourself, you need to analyze yourself and organize. So why I'm being stressed? Because if you are able to find out the cause, then you will be able to find out the stressor. So first thing is identify your stress. Then what are the stressors? That why I'm worried, what are the underlying factors why I'm stressed, then reason for the stressor. So these are the factors you need to identify, then selected and appropriate stress management. So whether you need a non-pharmacological approach or you should go for a psychiatrist or somebody who's expert in dealing with the stress therapies. Then evaluate yourself whether you are able to cope up with these stresses. If not, then go for another. So what are the techniques of management? We usually offer patients of anxiety and stress. The other than pharmacological therapy, two non-pharmacological therapies are very important. And among them, yoga exercises, deep breathing exercises are very famous in dealing with the stress management. So stress management involves controlling and reducing the tension and occurs in stressful situations by making emotional and physical changes. Non-pharmacological therapy and pharmacological. First, non-pharmacological is laughter therapy. So, laughter therapy is having very advantageous over the stress management issues, and patients having able to laugh stress away is the smartest way to ward off its side effects. So, it is said that laughter is the best medicine. So adopting a humorous view towards life situation can take the edge off everyday stresses, because this 21st century is called as a century of stress, because everybody wants that gets much more and better life. So not being too serious or in a constant alert mode helps maintain the equanimity of mind and promote clear thinking. So stress is the best medicine, and try to spread laughter and adopt laughter therapy in your usual life if someone is having minor stress in their life. What are the benefits? First, stress is because stresses reduce the sympathetic activity, so it lowers the blood pressure and reduces the heart rate, and it provides good cardiac conditioning, especially for those who are unable to perform physical exercise due to anginas or MIs. Also, it has hormonal effect that is releases and neuroendocrine hormones like epinephrine, cortisol, and growth hormones associated with stress response, and having a boost immunity function, as well as it triggers the release of endorphins, which are the usually natural painkillers. Another technique is autogenic training. Autogenic training is usually a technique used to alleviate many stress-induced psychosomatic disorders. And it was first introduced and published in 1932. And usually it leads to practicing session of at least 15 minutes, in which somebody having different modes of training, like sit in meditative posture. Right arm is like doing some exercises like sit in the mid postures, then feel like my arm is heavy, my arms and legs are heavy and warm, and each section is having 3 minutes or three or more practice sessions. My forehead is cool, my neck and shoulders are heavy, and I am at peace. So better way is first sit in a comfortable position and feel like my arm is heavy, my forehead is cool, having a deep breath. So this is another technique to release the strain or stress. Now, what are the effects of autogenic training is it usually restores the balance between activities of sympathetic and parasympathetic activity. Hobby, like getting a hobby where you feel inner soul is a very pleasant exercise and for the relaxation. Few people using having a games like outdoor games. Few are happy in doing the cooking, gardening, reading books, art. So these are the hobbies which makes you feel like inner soul peace and makes you happy is one of the exercise where anxiety is usually reduced. And one of the commonest thing is meditation. Deep breathing exercises, one of the commonest nowadays, usually applied by psychiatrists. And this is called deep breathing exercise, belly breathing exercise, or coastal breathing exercise. And we usually used to ask the patient to have these exercises at least once daily, where sit or lie comfortably with loose garments, slowly inhale, and then exhale slowly and rest and then repeat again and again. And if someone is having background music, then it may have additive effects. And worldwide, psychiatrists usually advise patients are having depressive illness and generalized disorders. They usually advise patients are having deep breathing exercises. Another thing I've already told, which is yoga exercise. Again, this is stress releasing exercises. And now this is very important. We usually keep on asking in the exams, what are the ABCs of stress management? Always take your time for at least 30 minutes per day for yourself, where you do whatever you want and you feel inner peace. Be aware of your stress and know when to step back and cool down your stressors, and concentrate on controlling your own situation without controlling everybody else. Means if you are feeling you are having some stress, then identify the stress and why you are stressed up, what was a stressor and why a stressor was happened in your life. So because you are over enthusiastic, over career builder, or some stress in your family or something else. So you need to first calm yourself down and control the situation without controlling everybody else. Daily exercise will burn off the stress chemicals and hormones like epinephrine, dopamine. So daily exercises essentials. Eat lots of fresh fruits, vegetables, as well as fluid intake, and forgive others. Don't hold grudges and be tolerant. Like, don't react too much. Be understandable and you have some sort of tolerance, because anxiety and stress occurs in everyday issue is when you lost your tolerance due to some chronic or resistant stressors. Identify stresses and plan to deal with them better next time, because if you are having stress in your life first time, then you are not able to deal with this stress at this moment, but plan for future time, because if this sort of stress will come in your future life, then how to deal with these stresses, and judge your own performance realistically, and don't set goals out of your own reach. Like someone having goals like I'll build my own hospital, I'll build my own bungalow, and his or her circumstances doesn't allow, then don't set such sort of unrealistic goals, because problem arises when you set so many goals which you cannot achieve, and you are not able to deal with these stresses. So keep a positive attitude. Your outlook will influence outcome, and limit drugs like alcohol, any drugs or other neurological stimulants, because they affect your perception and behavior. And no is word you need to learn to use without feeling guilty, because if you don't have any capability, then say somebody, no, I'm not able to do these activities. Outdoor activities by yourself, play your favorite music rather than watching TV, quit smoking, and relationship enhancing abilities, and forgive others, and at least some tolerance is better to deal with this anxiety issues. Sleep well with firm mattress, worry less, yearly goal setting, and zest of life. These are the few ABCs of your daily life issues to deal with these stresses. Now, other than non-pharmacological, which were yoga training, deep breathing exercises, and other measures, there are certain medications somebody is unable to cope with these anxiety issues, and there are lots of classification of anti-anxiety drugs. Among them is SSRIs, the selective serotonin reuptake inhibitor, which includes citalopram, escitalopram, which comes with the brand name of Citanu, fluoxetine, fluvoxamine, paroxetine, sertraline. These are the commonly used drugs. We usually use these drugs for anti-anxiety antidepressants. SNRIs is serotonin norepinephrine uptake inhibitors, which include desivenlafaxine, duloxetine, venlafaxine, which are commonly available in Pakistan. Tricyclic antidepressants, amitriptyline, one of the very common drugs, comes with the brand name of triptanol, clomipramine with the clomfranil, commonly available imipramine with the name of tofranil, and available in Pakistan. Nortriptyline is not available here, and protriptyline is also available. Other include monoamine oxidase inhibitors like Selyle is very commonly used. Other compounds like bupropion, metazapine, nefazodone, trazodone, and vortioxetine. These are available drugs in Pakistan. Other anxiety and hypnotic agents, because most of the time when patient is anxious or stressed, then his or her sleep is deprived. So for these purposes, we use benzodiazepines and commonly include alprazolam, diazepam, oxazepam, lorazepam, and other than clonazepam, which comes with the brand name of Rivotril. So these are the commonly used drugs we usually use for hypnotics as well. Other groups are, which is not used commonly, but to some extent in midazolam of patients having impaired liver and kidney functions. So estazolam, flurazepam, midazolam, quazepam are the benzodiazepine usually used for sleep purposes, right? So other includes miscellaneously hydroxyzine, which is available in Pakistan, and zolpidem is available in Pakistan. Rest of drugs are not available in Pakistan, but available in US. So it was all about the stress and stress management. And if you people have any queries or questions regarding this, you may ask your questions. Any question regarding stress and stressors? So it was all about stress and stress management. Hope to see you next time. Thank you. And please submit your attendance to Jagdish so that we can submit to the concerned department.